excruciating pain, would come and go. And you go to the doctor, and the doctor would say, okay, let's take some muscle relaxers, let's take some painkillers, don't go to work, take light activity, rest, and things will be better. And of course they did. Um, the pain in my legs would start to go away. I could actually walk again. I wouldn't have to use a crutch or a cane. I could sleep at night. It wasn't painful to turn over. Things that you take for granted, which are, just walking without tripping. Um, when you're at night, you don't have to wake up when you turn over. You don't have to be cognizant of the fact that, oh, let's see, first I got to try to move my legs, and then I have to move my back, then I have to move my shoulders. Try to move it all. So all of those things would tend to start to go away, and then I'd start to go back to my normal routine again, and they're right back. So over the last 2 years, I've been faced with, just that type of pain. And I was just getting over the last episode about 8 weeks ago, and I was at home, and I said, I know what's going to happen. As soon as I start back into my normal routine, I'm going to get injured again. But it was one of those things that the pain, like up in the thighs, if you've ever felt like you were on fire, that's about the way it felt to me. I mean, it would burn from the skin all the way to the bone. Um, it's like I say, simple things like walking upstairs. You couldn't do one foot in front of the other. You had to take one foot up, and then kind of straddle, come up the next one. So you kind of stair step your way up the stairs. Things that you just take for granted. You just walk upstairs. Walking down the sidewalk. There's little imperfections in the sidewalk. And your feet and your mind are all connected in the nerves. And as you'd walk, you couldn't walk. You'd trip on even the smallest little imperfection in the pavement. So those were the things that really caused me to have a lot of pain and discomfort in my life. That I wanted to try to find out, how do I get rid of this pain? How do I get back to a normal life? To enjoy life myself. Well, I was at home, like I say, just recovering again about 8 weeks ago, and I happened to see on television a infomercial, and it was Dr. Krish Tomchak. And he was from Health Source. He developed, I guess, this Health Source piece. And he was, I guess, working with the DRX 9000. And he was talking about, here's the things that people have. And he starts talking about, the burning sensation, the tingling sensation, the pain, all these things that I was experiencing, had been experiencing for the last 2 years. And it was like, he was telling me all this on the infomercial, and it's like, this is what I've been telling my doctor. These are the exact same symptoms. And of course, it was about a half-an-hour program, and he was talking about the DRX 9000 and how technology has changed and allowed to bring technology into medicine. All right, and I mean, I've been in technology for over 40 years, and so I know that there are wonderful things you can do with technology and how you can adapt that to everyday life, and in this case, to something that would help people. So at the end of the program, I called the 1-800 number, and the next thing I know, I was talking with the folks here at Dr. Palmer's office, and so that's how I came about, learning about the DRX 9000 and what it could do or possibly do, for me. Well, they went through, a series of questions. One, trying to confirm that yes, I could be a candidate for the program. About your pain, if you had back surgery. Where is your pain? How long have you had it? What kind of treatment have you been doing? And, after going through that, they said, yes, we think you would be a possible candidate. Let me send you out some information, fill out some medical history, and then let's come in for an exam and then really see whether or not it's the program's for you. And so I did that. A couple weeks later, I came in for an exam. We went through, we talked about, with Dr. Palmer, talked about what the treatment was all about. And of course, the first thing he says, I need people that are committed to the program. I only have a certain number, a limited number of slots that I have, and I've got to be able to treat the people that need the technology the most. And I says, that's great. I says, I am committed. And he said, well, we'll see how committed you are. And he says, I want you to go down for an MRI in Stockton, California, which is about, an hour's drive from here. And he said, I want you to do what's called a sitting lombard MRI. And I said, that's great. He says, now this is probably not going to be covered by your insurance. And I says, let's not worry about that. Let's see if we can get this problem fixed. So that's kind of where we went. We went down and got an X-ray or the MRI done. A couple days later, came back up, reviewed the MRI, and Dr. Palmer says, well, he says, what you have there is you've got, he said L3, L4, and L5 are herniated. You've got 3 herniated discs, and that's what's causing all this pain. And I said, okay, so where do we go from here? And he says, well, we start the treatment on this DRX 9000. I said, let's do it. So for 6 weeks, I was on the machine. About 2 weeks into the treatment, well, in fact, before that, first couple of treatments, you could actually feel the difference. I mean, the relaxation of the spine, the feeling coming back to where I didn't have, where I had numbness. Now I started to have feeling, started to have twitching. I mean, I hadn't had twitching in my legs for probably over a year. Kind of a benefit was I had numbness in my left arm. I thought, I got a heart problem. And that started to go away, and now that's, it's completely gone. I have, I got full feeling back in my left arm. I've got feeling back in my feet. Those were things that, as I progressed, each time I did a treatment, something came back that I had missed, and the burning sensation started to go away. I was able to sleep at night, I didn't have to, wake up to turn over. It was just an automatic thing that your body does every night. But like I said, about 2 weeks into the treatment, I went to lunch with some friends, and I had parked downtown, had to walk about a block to the restaurant. And I walked down, as I'm walking down to the restaurant, the friends are standing in front of the restaurant there, and when I got closer, they said, boy, you got spring back in your step. And I said, what? And I said, you can tell the difference. I mean, these are friends that I've had, and they knew I was going through treatment. They said, you got spring back. I mean, it looked like you're feeling good. I mean, they could tell just by seeing the way I was carrying myself and walking down the street. And to me, it was like, yes, I mean, this is great. This is good stuff. And like I say, for the last 6 weeks going through treatment, every day just got better and better and better. Every Tuesday and Thursday, we fill out paperwork here, and it says, please assess where you are, so the doctor can help see what the progress is. And about 3 weeks ago, what it says, what kind of pain do you have? Where is it? How severe is it? How cognizant are you of the fact that you're having pain? Well, about 3 weeks ago, I was putting no pain, no pain, no pain. I mean, and what a difference, from having, pain that would keep you awake at night, you couldn't sleep, to the point where it's like, I'm feeling great, and you see people coming in for treatment, and you guys, I was there, I was there 3 or 4 weeks ago, but, now it's like, I feel guilty even being here, taking up a spot because I'm feeling so good.